Take control of your health and wellness.
My very special guest today, Grace Marie Turner, president of the Galen Institute. Welcome back, Grace Marie.
Well, Cary, it's a pleasure to be with you, and I do have to say, you are the most knowledgeable about health policy, just superlative.
And now, ladies and gentlemen.
And now, America's healthcare advocate, Cary Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Our producer today, Mr. Darren Wilhite. I'm your host, Cary Hall. This is your show, America. Thank you for joining us and making us one of the most listened to talk shows throughout the United States. We are now up to 153 stations. We just added KGNC, AM/FM, Amarillo's Country, 710 AM and 97.9 FM in Amarillo, Texas. We want to thank Juanita Davis and all the folks over at Radio America, one of our syndicators. They do a wonderful job. And we want to thank the folks in Amarillo. We're happy to be on the air there and have you join our family here on America's Healthcare Advocate. So once again, we thank the good folks at KGNC, AM and FM, 710 AM, 97.9 FM. We are now at 153 affiliates, thanks to all of you in our listening audience. Well, today is the day I'm going to do the third in my series on Medicare for All. Now, you know, it's important to understand what I'm trying to do here. I'm trying to lay out the case so you can make a decision in this next election, because this is going to be, in my opinion, probably the number one issue or number two issue in the election. What are we going to do with the healthcare system? We have one side, the Democrat side, that wants to roll this all up and make it a government-run system under the theme of Medicare for All. However, it's not what we know as Medicare today. That will go away for those of us that are chronologically challenged. Your Part A, Part B, Part D, your private Medigap or Medicare Advantage plan, that will all disappear if this becomes the law of the land and this becomes new public policy where Medicare for All, in other words, a single-payer health insurance system, which is what it really is. So, as many of you know, this broadcast originates out of Kansas City, Missouri, at our flagship station here at Intercom, KMBZ, AM, and FM. So, you know, we're what I think a lot of people, first of all, you know, this is called flyover country, if you will, and folks here are considered to be somewhat conservative. Midwesterners certainly don't share a lot of the views that we see in California or New York or Massachusetts or Vermont. But on last Sunday, in our newspaper here in this town, there was a full 3-page article on Medicare for All. And I thought, you know, when I read this, it made me think, wow, you know, I know this is an issue. I know it's being talked about a lot, but I'm not sure the public really understands how serious the Democrats are about making this a reality, and what does it really mean? So on today's show, I'm going to give you some different excerpts out of different papers, the New York Times, which I read, the Wall Street Journal, which I read, and you know, the Kansas City Star here, especially as it refers to this one article. But I want to use this to kind of set the stage for where we're at in this discussion. So this is out of the May 5th edition of the Kansas City Star, and it's called Medicare for America. And it starts off by talking about a February poll that CNN did, said 54% of Americans, when asked, supported a national health insurance program, even if it meant paying higher taxes, compared with 41% who opposed it. Now, they don't lay out anywhere in this article, and I will talk about that as we get further into the broadcast, what those taxes are going to look like. In fact, there's actually a CBO estimate now. Congressional Budget Office, the Democrats have asked the CBO to mock up what this would cost and what it's going to look like, and I'll get into that a little later in the show. But there are estimates out there. They're pretty close to what I've used before. They range from $23 trillion to $32 trillion over a 10-year period. 32 being the number that appears to be more accurate and a kind of a consensus number about what it's going to cost. So let's go back to this. So 54% said they were for a national health care system, even if it meant higher taxes. Now, like I said, they didn't tell them what that meant in terms of higher taxes, just that it would be higher taxes. However, the support drops to 40% if it meant completely replacing private health insurance. Now the opposition rose to 54%. Well, let's be clear here, okay? They fully intend to, if you look at Bernie Sanders' website, if you look at Representative Parmaya Jayapal, it's an Indian name, and I'm not good with these, and I apologize for that. He is a Democrat out of Washington. He is the sponsor of the Medicare For All bill, and he, along with all the prominent Democrats, believe that this is the way that we should go, and very clear. What, if you recall, what Bernie Sanders said on the town hall he did on Fox. When he was asked, I think by Brett Baer, does that mean we would get rid of private health insurance? And I think Baer actually used Blue Cross and Blue Shield, and he said, yeah, they could stick around to do cosmetic surgery, Botox, and that kind of thing, but they're not going to be around anymore. We're going to eliminate private health insurance. So people are for it, supposedly, until they find out their private health insurance is going to go away. And 165 million Americans are on employer-sponsored health care plans, most of whom are very happy with what they have. They like what they have. They like their doctors. They like their choices, etc. So this plan clearly will get rid of that, all right? And that's the way that it's going to work. So what they want to do here, and the universal coverage program. So the way that Democrats want to do this is they want to expand Medicare to cover the entire U.S. population. I'm reading again out of the article. Add new dental and vision coverage. Now, they just added this piece. This was not in the original estimate. So now they're going to take over dental, they're going to take over vision, and they're going to take over medical services. I have to do a quick aside here. Have you ever looked at Europeans in terms of their dental work and what it looks like? You ever notice? I mean, you really, you look at people in Great Britain or in France or some of the other places in Europe and where they have national dental programs. What do you think? You ever notice they don't look all that great? Well, anyway, I just had to put that out there. But having said that, now they're going to expand this to take over medical, dental, and vision. That's all part of this. And so Representative Jayapal goes on to say, Republicans would like you to believe that Medicare for All will take away health care that you have. She said, what they don't point out is it would actually give you more choice than those who are covered by their employers now, and you would have more choice and less cost. And the thing that would be cut out is the insurance companies. I don't know anybody that really loves dealing with insurance companies. I'll give her that. I don't think there are a lot of people that actually enjoy dealing with insurance companies. Let me ask this question. Let me reverse that thought process and ask this question. How many of you like dealing with government agencies? You ever had to deal with the IRS? You ever had to deal with Medicare? Have you ever had to deal with Social Security or any other U.S. bureaucracy? If you're in business and you run a manufacturing facility, you ever had to deal with the EPA? If you're in business, you ever had to deal with the Department of Labor? Let's be clear here, okay? What we're talking about doing is, while you may not love dealing with insurance companies, I don't think you're going to love dealing with government-sponsored health care from the standpoint of bureaucrats telling you where you can have care, who's going to provide that care, and what you're going to get. And I'm going to get into some of the other pieces that are going to be affected by this. And I'm going to talk about how does this affect pharmacy? How does this affect new drugs coming on the market? How does this affect new surgical procedures? All these kinds of things. I'll talk about all of that. But the whole idea behind this show today is to frame the issue so you understand what's at stake here, because I guarantee you, ladies and gentlemen, this is not going away. Okay, it's gaining momentum. I was surprised. I really was very surprised. We have a newly elected Democrat over on the Kansas side, Sharice Davis. And she's in a real pickle right now because she will not come out and endorse this unequivocally. And so she's catching a lot of heat, and they're putting a lot of pressure on her. And that's going to continue as we get closer to 2020. So when I come back, we'll go into the second part of my show on Medicare for All. As I said, this is the third in our series. and I'm trying to explain to you what this is going to look like and what it's going to cost. Stay tuned. I'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA.